High blood pressure, also known as hypertension, is a silent condition that affects millions of people around the world, particularly as we get older. Unlike other health conditions, high blood pressure often doesn't present obvious symptoms, which is why it's often referred to as the silent killer. It can slowly and quietly damage your heart, blood vessels, kidneys, and other organs without showing any noticeable signs. Over time, if left untreated, hypertension can lead to severe health complications such as heart disease, stroke, kidney failure, and even vision loss. The most troubling aspect of high blood pressure is that it usually doesn't cause noticeable symptoms until it has already caused significant damage to the body. This makes it all the more important to monitor your blood pressure regularly, particularly if you're over 40, as the risk increases with age. Fortunately, the good news is that by recognizing the symptoms early and taking proactive steps, you can prevent the progression of hypertension and reduce your risk of developing life-threatening complications. Understanding the risk factors and symptoms associated with high blood pressure is key to maintaining your overall health. While high blood pressure may not always produce clear signs, there are certain warning signals that could indicate your blood pressure is elevated. Regular checkups with your healthcare provider are essential in detecting high blood pressure before it leads to more serious health issues. In addition, adopting a healthy lifestyle that includes regular physical activity, a balanced diet, stress management, and avoiding smoking or excessive alcohol consumption can help control and even prevent high blood pressure. Recognizing the symptoms early and making these lifestyle changes can make a significant difference in managing your blood pressure and ensuring a healthier future. One of the most common symptoms of high blood pressure is frequent headaches, particularly those that are intense and persistent. While headaches can be caused by various factors, if you're noticing that they are becoming more frequent or severe, it could be a sign that your blood pressure is elevated. High blood pressure puts extra strain on the blood vessels, particularly in the brain, which can lead to discomfort and pain. These headaches often occur in the morning and may be accompanied by a feeling of tightness or pressure in the head. They can be dull and persistent or throbbing, sometimes causing a sensation that feels like the head is being squeezed. This type of headache may be more noticeable if the hypertension is severe or has been left untreated for an extended period. In some cases, the headaches can be so intense that they interfere with daily activities and make it difficult to focus or function. If you experience these symptoms regularly, it's important to consider the possibility that they are related to high blood pressure. It's important to note that not everyone with high blood pressure experiences headaches, and some people with hypertension may not have any noticeable symptoms at all. However, if you find that your headaches are becoming more frequent, it's a good idea to take it seriously and have your blood pressure checked. Early detection is key in preventing further complications. In addition to headaches, other symptoms such as dizziness, blurred vision, or shortness of breath may also indicate high blood pressure. These additional signs can make it even more crucial to monitor your health and address any issues promptly. If you experience these symptoms together with frequent headaches, it's essential to consult with your healthcare provider as soon as possible. A simple blood pressure check can give you the insight you need to take proactive steps in managing your health. Taking action early can prevent long-term damage to your health, reduce the risk of more severe conditions like heart disease or stroke, and ensure that you maintain a better quality of life. Don't wait for the symptoms to get worse. Schedule a checkup and take charge of your health today. Another common symptom of high blood pressure is dizziness or lightheadedness. If you ever feel like the room is spinning or experience a sensation of unsteadiness, especially when standing up quickly, this could be a warning sign that your blood pressure is too high. The dizziness occurs when the blood flow to the brain is compromised due to the increased pressure in your arteries. This can make you feel as if you're about to faint or lose your balance, which can be both alarming and dangerous. High blood pressure forces your heart to pump harder to circulate blood throughout your body, and as the blood vessels become more strained, they may not expand and contract as efficiently. This can lead to reduced blood flow to the brain, causing those dizzy spells. It's particularly common when standing up from a seated or lying position, a condition known as orthostatic hypertension, and can lead to feelings of lightheadedness or even fainting. In some cases, the dizziness can last for a few seconds or minutes, while in others, it might feel like a persistent imbalance or unsteadiness. If you frequently experience dizziness, especially along with other symptoms like headaches or shortness of breath, it's essential to have your blood pressure checked. These symptoms are often linked to uncontrolled hypertension, and leaving the condition untreated can increase the risk of more serious health complications, such as strokes or heart disease. Dizziness, when combined with other warning signs, should never be ignored, as it may be an indicator of a more serious underlying health issue. Taking steps to monitor your blood pressure and manage it effectively can help reduce the occurrence of dizziness and prevent further health risks. Regular checkups, staying hydrated, reducing stress, eating a balanced diet and exercising can all play a key role in controlling high blood pressure. Remember, early intervention and lifestyle changes can make a significant difference in controlling high blood pressure and improving your overall health. Don't hesitate to reach out to a healthcare professional if you're experiencing frequent dizziness or other related symptoms. It's always better to be proactive when it comes to your health. You might also experience shortness of breath, even during simple activities, such as walking upstairs or carrying groceries. If you find yourself getting winded more easily than before, it could be a sign that your blood pressure is elevated. This is particularly concerning because it indicates that your heart is under more strain than it should be. When blood pressure is high, it puts extra pressure on your heart, making it work harder to pump blood throughout your body. Over time, this strain can lead to weakened heart muscles or other complications that affect your lungs and overall circulation. As your heart struggles to meet the demands of your body, it may not be able to deliver enough oxygen-rich blood to your muscles and tissues during physical activity, resulting in that feeling of breathlessness. This shortness of breath can occur gradually, so you might not notice it right away. You may find yourself becoming easily fatigued or out of breath after activities that you used to do without issue. Simple tasks like climbing a flight of stairs or walking around the house may start to feel more exhausting. It's important not to dismiss these symptoms, as they could be warning signs of hypertension affecting your heart and lung function. If you're experiencing unexplained shortness of breath, especially alongside other symptoms like chest pain, dizziness, or headaches, it's essential to get your blood pressure checked as soon as possible. These symptoms are not something to take lightly. Addressing high blood pressure early on can help prevent more serious complications, such as heart failure, stroke, or even a heart attack. Regular monitoring and proper management of your blood pressure can help restore your ability to breathe easily and stay active. Lifestyle changes, such as reducing stress, staying physically active, eating a heart-healthy diet, and avoiding smoking or excessive alcohol consumption, can help keep your blood pressure in check. Taking control of your health today can make a significant difference in your well-being tomorrow. Don't wait. Getting your blood pressure under control can help you live a longer, healthier life. Blurred vision or seeing spots is another red flag that should not be ignored. High blood pressure can have a direct impact on the blood vessels in your eyes, causing them to weaken or narrow. As these blood vessels are damaged, they can affect the flow of blood to the retina, leading to vision problems. When blood pressure is consistently high, it can also lead to a condition known as hypertensive retinopathy, where the blood vessels in the retina become swollen or leak fluid. This can result in blurred vision, spots, or even temporary loss of vision in severe cases. Over time, if left untreated, this can cause permanent damage to your eyesight. You might notice difficulty focusing, seeing flashes of light, or experiencing the sensation of having dark spots in your vision. These symptoms can be subtle at first, but if you are experiencing any changes in your vision, it's crucial to have your blood pressure checked. The good news is that if you catch high blood pressure early and manage it properly, you can often prevent or minimize the damage to your eyes. Regular eye exams, along with blood pressure monitoring, are essential for protecting your vision and overall health. If you experience blurred vision or spots, don't wait. Schedule an appointment with your healthcare provider to get checked and take the necessary steps to safeguard your eye health. Chest pain should never be ignored. If you experience any discomfort, tightness, or a feeling of pressure in your chest, it's critical to seek medical attention immediately. This could be a sign of heart strain caused by high blood pressure, and it might indicate that your heart is working harder than it should be to pump blood throughout your body. When blood pressure is elevated for an extended period, it puts extra stress on the heart and blood vessels. This added strain can increase the risk of serious conditions like heart disease, heart attack, or even stroke. If you feel any chest pain, it's essential not to wait or dismiss it as something minor, especially if the pain is accompanied by shortness of breath, dizziness, or nausea. Chest pain can be a warning sign that your heart is struggling due to the added pressure from hypertension. The heart might not be receiving enough oxygen, or the blood vessels might be narrowed, increasing the risk of damage. Immediate medical evaluation is necessary to determine whether the chest pain is related to high blood pressure or another potentially life-threatening condition. Remember, when it comes to your heart, every second counts. If you're ever in doubt or feel uncertain about chest pain, seek professional care right away. Addressing high blood pressure and preventing further damage is key to maintaining a healthy heart and overall well-being. Another symptom to watch out for is fatigue. If you find yourself feeling unusually tired or drained, even after a full night's rest, it could be a sign that your blood pressure is not at healthy levels. High blood pressure can make your heart work harder than it should, leading to overall fatigue and a sense of constant tiredness. When your heart is under constant strain due to hypertension, it can affect your energy levels, leaving you feeling worn out and less able to carry out daily activities. The body struggles to get the proper oxygen and nutrients to vital organs, including your muscles and tissues, which can lead to feelings of weakness and exhaustion. It's important to note that fatigue caused by high blood pressure is not just about feeling sleepy or needing extra rest. It's a deep sense of tiredness that doesn't seem to improve, no matter how much you sleep. This persistent exhaustion could be a sign that your body is being overwhelmed by the effects of elevated blood pressure. If you're experiencing this kind of fatigue, especially along with other symptoms like headaches, dizziness, or shortness of breath, it's time to check your blood pressure and consult with your doctor. Identifying and managing hypertension early can help prevent further complications and restore your energy levels so you can feel your best. Lastly, nosebleeds are another symptom to be aware of. If you're experiencing frequent nosebleeds without a clear cause, it could be related to high blood pressure. When blood pressure is elevated for extended periods, it can cause damage to the delicate blood vessels in your nose, leading to spontaneous bleeding. High blood pressure puts extra strain on your blood vessels, making them more likely to burst, especially in areas with thin walls like the nose. This can result in frequent or unexplained nosebleeds, which might not seem like a big deal at first, but they can be a sign that your blood pressure is dangerously high. If you're noticing that you have nosebleeds more often than usual, or if they seem to happen without any obvious reason, it's important to get your blood pressure checked. Frequent nosebleeds, combined with other symptoms such as headaches, dizziness, or blurred vision, should never be ignored, as they could indicate that your hypertension is putting strain on your body. Don't wait for more severe symptoms to appear. Consult your doctor and have your blood pressure monitored to ensure that you're taking the necessary steps to protect your health. Recognizing these symptoms early can help prevent more serious health complications down the line. Remember, high blood pressure can be controlled, but the key is to catch it early. If you notice any of these symptoms, it's important to talk to your doctor as soon as possible. Early detection allows you to take action before complications arise, preventing long-term damage to your heart, kidneys, and other vital organs. Regular checkups and a healthy lifestyle are crucial for managing blood pressure. Maintaining a balanced diet, exercising regularly, reducing stress, and limiting alcohol and sodium intake are all effective ways to keep your blood pressure in check. Your doctor may also recommend medication if necessary, but lifestyle changes remain a cornerstone in hypertension management. By taking proactive steps, you can protect your overall health and reduce the risk of heart disease, stroke, and other serious conditions associated with high blood pressure. So, don't ignore the signs. Get checked, stay informed, and make heart-healthy choices to live a long and vibrant life.